My presentation is for transcultural nursing is providing culturally competent care to West Nigerian patients. Nigeria is comprised of a population of 168 million people, and that was from 2012, primarily made up of Western Nigeria, which is Christian based, and so is the eastern and southern region, but I'm focusing on Western Nigeria versus the northern region of Nigeria that is predominantly Muslim. The cultural beliefs in Western Nigeria, people believe that health is the absence of sickness and disease. Health is valued, but poverty rates may prevent people from seeking modern medicine due to the expense and availability. Home remedies utilized in villages are usually horrible to the palate, but they do cure illnesses. And traditional healers, herbalists, if you will, practice traditional medicine. City populations mainly visit doctors if it's something that they can afford, and home remedies include items that are cooked, soaked, and usually put in bottles or some type of container. Across the lifespan, religion is very important in the treatment of Western Nigerians. You have to know whether the person is Christian versus Muslim. Pregnant women go to different traditional birth assistants or what we would call midwives for birthing issues. Otherwise, herbalists are seen for their treatment. And mothers of breech babies are treated with charm juju rings. So, Christian women in this culture are open to a physician from either sex, whereas the Muslim women would prefer a woman nurse or doctor. And of course, I'm told that they will not decline care for that reason, but they do have preferences. Midwives have no formal training. Their skills are passed down from one generation to the next. And these juju rings that I spoke of are made by herbalists, and they are very effective, I'm told. People still die, of course, but it's part of their voodoo. And I want to just clarify that that is not the voodoo kind of witch doctor image that we have in the Western world, but it is what they consider voodoo. There is a high incidence of maternal mortality that is found in Western Nigeria. 13 out of 24 of the 6,519 people, that's 20.3%, in one study. This was a multi-stage sampling design using stratification and clustering. And the findings pretty much conclude that more education, training, and planning is needed for midwives. As far as children from 0 to 17 years old, pediatric services is a new idea for Nigeria, and hospital units are not separated as they are in the United States. Everyone goes to general hospitals. Doctors will treat all medical complaints, which is something that's very different for us in the Western world. And dentistry is also rare and expensive. People chew on these sticks. They're called Peko or Peko Ejibu, and they're used for tooth cleaning and for strengthening. Um, Toothbrushes and toothpaste are new to villages because prior to this time they were too expensive. From 18 to 64 years old, the doctors are not specialized. General surgeons, for example, do most surgical cases, so it's not a matter of whether you're a neurosurgeon or whether you are a general surgeon, don't do GYN, they do it all. Doctors can and will treat all medical complaints, as I said, and the life expectancy in Nigeria, it's only 52.1 years of age. Um, Older adults, there are no nursing homes in Nigeria. The elderly are seen as useful to society, and their needs are provided by their family in the home until they die. Religion and culture, again, play a large role in societal expectations in communities. Community health systems called dispensaries are usually free, but patients buy their own supplies and not available everywhere. Community health assistants, they also visit the homes because they're interested in providing preventative care. Workers are trained by the government to do this. For example, in Nigeria, there's no running water out in the villages, so water is stored in clay pots. And so these community health assistants go out. They're known as the Woli Woli, which means they're house checkers, and they check for microorganisms that cause sickness. Now I'm told that the Woly Woly, when they're coming, the residents have a little song that they've made um, with the words Woly Woly in it, so that the other villagers know that the house checkers are on their way. Common health issues in Nigeria include the HIV disease, which of course is rampant in Africa as a whole, but it's less prevalent in Nigeria than some of the other countries. Hernias are prevalent because people do a lot of physical activity like farming and lifting. And then the TB vaccine. TB is an issue, but the TB vaccine I wanted to mention is given to children, especially those attending schools. That's why a lot of the nurses that come from Africa, they'll never pass our TB skin test, or they'll show sensitivity, um, and because they receive that vaccine. And then, of course, there's malaria and appendicitis are other common issues. Pulmonary TB, according to one study, is a most frequent indicator of AIDS. Managing care for this dual disease, having both AIDS and TB, is very difficult due to the fact that there are medication interactions that could go on. Anti um, TB meds are taken inconsistently as well, which leads to drug resistance, and that is for a number of reasons, but one mainly because TB meds are not, their medications are not often free, and so the unaffordability of these medications cause patients to take them on an irregular basis. There is susceptibility test facility scarcity. There's just not enough places, and or the TV meds themselves are just not even available. So even if you could afford them, they're not available to the people there. I thought it'd be interesting because this was something that was interesting to me. I work in the OR, and I wanted to make a few comments about surgical practices before I end. There are government hospitals that exist, and these are less expensive than the private hospitals, but they don't supply anything for you. There are no disposable items like there are in our US ORs. They rewash lap sponges, which I understand they used to do in the United States as well, but they still do this. They boil needles and rethread them. Um, you buy your own supplies when you go to surgery from some local unregulated pharmacy. So if you came to the hospital and you were ill, they would give you a list of items that you needed to go buy from the pharmacy. And when you had those items, you returned to the hospital for your procedure to be completed or scheduled. And the young man that I interviewed to get a lot of this information, um, this young man told me that um, the when they that he had two brothers, sorry, that had passed away because he couldn't afford the list of items. And these are everything from IV fluids to IV lines. You name it, you think of it, and you have to buy it at the pharmacy. These unused items, they are unused items that are bought, but they're also non-refundable. So in summary, I just want to say that data is that I've presented relates to the large number of citizens living in villages and out in the country area of Western Nigeria. Modernization does exist in the cities and suburbs, so I don't want to play into the misconception that all African society is not modern at all and live in the dark ages. Um, there's modernization that does exist in the city areas, and that cultural requests on our part must be taken into consideration when we're caring for patients like the Muslim females wanting female caregivers, and patient financial status affecting health decisions. And that is the conclusion of my presentation. Thank you very much.